is to create an interactive and informative environment where we can all grow professionally. And today I will be guiding to you through this course of session in evaluation and management. So basically, what is the evaluation and management? As per name indicate evaluation and management. Obviously, evaluation means evaluate. How to evaluate, and management means manage that conditions, manage that particular problems. Suppose a patient come with doctors, clinic or hospitals to with some problem, some complaint or some symptoms. First of all, a physician may ask him, what is your chief complaint? CC. So suppose if patient describe his own words, means we can call as HPI, history of present illness. The suppose patient having abdominal pain since last night. So physician is evaluating a patients, asking some basic questions of location of pain, duration. So, physician may ask him some investigation questions like what did you eat yesterday? Did you take some food? He may guess some, asking some if injury or some food poisoning, etc. So if patient is describing, I had eat some spicy foods yesterday, so physicians may evaluating, is maybe guessing he is suppose having any uh, gastrointestinal conditions. Now next, management. Now depends on patient's complaints severity. If patient's having pain moderate or low, if suppose patient having a moderate pain, so in that case physicians maybe give him a painkiller, or if physicians may having some again some want some investigation, so physicians may order some lab and order some CT abdomen. This is the part of evaluation. And for temporary pain manage, he will prescribe him a painkiller medication. So this is management. Now, as per APC, CPC, CPT Codebook, ENM services guidelines are settings, types of services, patient status, office outpatient services, new patients, and established patient. Later, hospital observation services, inpatient hospital care, emergency department services, consultation, office consultations, and inpatient consultations, critical care services, nursing facility services, home or resident services, preventive care services. So remember one thing here. Here each services has its own code range and unique guidelines. So today's video is a demo class, demo video. This is a road map for our journey, how we uh, learn which important part is in this course daily session. I will give some hint for interview. Daily I will give some interview questions, and uh, in coming days we are going to deep for each services, outpatient services, inpatient consultations like that. Again, what is the new patient and established patient? Obviously, new patient is a patient who has not received any professional services from the physician, qualified healthcare profession, or another physician's qualified healthcare professional, exact same specialty and subspecialty who belongs to the same group of practice within the past 3 years. This is the new patient. And what is the established patient? An established patient who is has not received professional, or an established patient is one who has received professional services from a physician or a physician in the same group practice of the same specialty within the previous 3 years. In this case, patient is established for that particular physicians or physicians particularly same group, suppose urgent care, family practice, etc. Means in last 3 years patient is frequently uh, visiting to that physicians of group of facility. uh, Next point is, here is the decision tree for a new versus established patient. So see, received any professional service from the physician or another physician in group of same specialty within last 3 years? If no, obviously this is the new patient. If yes, then again divide exact same specialty. If no, then new patient. If yes, again exact same specialty. If yes, then established. Then no, so new patient. The three key elements are number of complexity of problems addressed. This is the for calculating a MDM, medical decision making table. Number of complexity of problems addressed evaluates of disease, conditions or injuries managed at the encounter. Then amount and complexity of data to be reviewed, analyze data, risk, how they determine MDM levels, like that. So let's see the ENM audit worksheet so you can better understand uh, terminology and what is the nature, complexity, and problem address. Here, problems. What is the problem? The problem is a disease, conditions, illness, injury, symptoms, sign, and finding, complaint, and or other matter addressed at the visit with or without a diagnosis being established at the same of the visit. Later, problem address, minimal problem, safe, limited, or minor problem. What is the stable chronic illness? What is the acute uncomplicated illness or injury? Stable acute illness, chronic illness, exacerbations, or progression of side effects of treatment, and then data point, amount and or complexity of data to be reviewed and analyzed. What is the analyze? What is the test? What is unique? And a combination of data elements. External, what is the external physicians or other qualified healthcare professional? Then risk of complications and or morbidity or mortality of patients management risk, morbidity, social determinants of health, surgery. Then prescription drug management, drug therapy requiring intensive monitoring, toxicity. This is, that was the is now this is the MDM table we used see previously. This is the table A, this is table C, this is table B. This is data point, amount, and composite of data report. Here, this remember one thing in outpatient services we are calculating MDM only 2 by 3. 2 by 3 means table A, table C, and table B. Out of 3 tables, we are considering only 2 tables which goes to level high. Suppose this is moderate, this is a moderate, and this is a low. So 3 by 2, out of 3, 2 are moderate, so we are going to be moderate. This is the simple. So yes, you must consider two MDMs for the overall MDM level calculation. Chart key calculations are for data category, label category, one text and that one text and one text and documents, one text and documents, two text and documents, minimal, limited, data science function calculation, time-based coding calculation also. We have time-based coding also. This is a long time calculation. See, activities of time, uh, preparing to see the patient, such as reviewing the patient's record, like that. See, this is a prolonged services, outpatient, and for inpatient is double line overnight. This is for CMS code. Now, this is the EM code tables, office visit and other outpatient. This is a new patient, code is 992022992215, 992022992205 is a new patient, and 992122992215 is the established patient code range. Obviously, 12202 is the straightforward MDM, time is 15, 203 is history and exam is low MDM, time is 30, 204 is moderate, 205 is high, time is obviously 60 minutes. If time is 16 plus means if time is 17 plus 5 minutes, so we can go with prolonged service. Next part is hospital and observation services, 99221 initial, 99222, 99223, 99418. This is the prolonged course. Subsequent 99231, 99232, 99233, 99448. Now same day admit charge, must be at least 8 hours. Inpatient same day 99234, 99235, 99236 medical approved history straightforward model, and the same day admit and discharge services, and this is the discharge 99238, 99229, time is 30 minutes or less than, this is the greater than 30 minutes. uh, Next code ranges for consultations, outpatient consultations, inpatient consultations. Code ranges 99242, 99245, then inpatient 99252, 992, nursing facility, home residence. This is the emergency department 99812, 99855. This is critical critical care services, the 99291 for AMA times, same times. This is the Medicare Medicaid. Speed shared in services. This is modifiers. We will see next sessions how to apply modifier 20. Generally in ENM we used to modifier 25 mainly, and for follow-up visit or after care we use modifier 24. This is the MDM table we are going to use for calculate the levels, because this is the abbreviations I will show you. This is the medical abbreviations, some terminology, complex notes I will share you again, not you. And now element, this is the MDM, how to calculate the MDMs. What is the MDM? Medical decision making, number and complexity of problems, amount of data to be reviewed. This is the I will share you. We'll see next videos. And this is the what is the primary versus secondary diagnosis, and how to select and sequence correctly. This is our course content, and we will see deeply in each services, and I will share you each day some few interview questions, and last day of the session I will give one trick how to crack a interview. I will give a trick how to control on interviewers. Thank you friends, thank you for watching. Let meet, let's see you again next video. Thank you very much.